Hi, I'm Barbara C. Phillips. I'm a nurse practitioner. I'm the founder of Nurse Practitioner Business Owner, and I've been teaching advanced practice clinicians about business startup, and I've been doing it through writing and publishing and speaking and through course development for about the last 10 plus years. And so, one of the things that I've been doing is I publish a newsletter every week, and twice a week we send out emails. And one of those is on Wednesday, and it's our question of the week. And I get those questions from all the questions that have been coming into us through our email and through a submission site that we have for questions. But you know what? Those questions go nowhere. They've just been in emails. And so now I'm using this particular platform in order to share that information and to answer all of your questions. And so I'm glad that you're here. Welcome. And at the end, I will tell you how you can submit your question and to learn more about NPBO. So this week, we're going to tackle questions that I received after I did the Lunch and Learn webinar series that was done on September 20th. This was part 2 of actually what's going to be 3 parts, but this is part 2 of how do you actually go about opening that practice once you've already done your homework, which is what we talked about in part 1. So here's just some of those questions, and we're going to go through them now. So the first one, is a business license the same as registering your business with your state and county? And you're going to come to learn that my favorite answer is it depends. And it does apply to this particular question as well. And what it depends on is what are the rules in your state. So when I first registered my business in Washington State, I went onto the Secretary of State website and I registered my business there. And in that process, they told me where I needed to go to get additional licenses, including my city. And so that's how I did it there. Now, here in Missouri, I again went to the Secretary of State, got my corporate license for this particular state, got my business license, and then they didn't tell me to go anyplace else. But knowing what I know now, I went ahead and I contacted the city of Columbia, and lo and behold, yes, I needed to apply for a business license with the city there as well. So you're going to need to see what is required in your state. You may or may not need city and county licenses. You will need a state license, and I can tell you likely you're going to need those other licenses because this is part of how they collect taxes and revenue for the cities and counties. So hopefully that helps. Just go to your Secretary of State and take it from there. The next question is, what is the best site to see the published Medicaid fee schedules for all states? Well, the answer here is pretty easy. There is not one site that I'm aware of to see all of the states' published fee schedules. Each state has their own fee schedule. So just go to the Medicaid office website in your state and take a look. That is public information, so you should be able to access it. What I do want to caution you about, though, as a nurse practitioner, as a physician assistant, you may find what you're allowed on that fee schedule is going to be different than what is actually published. So just like with Medicare, we receive 85% of the physician allowable. In Medicaid, it can vary all over the board. I have seen as low as 60%, if you can believe that, all the way up to 100% or on par with physicians. So it just depends on your particular state, but just be aware of that when you start looking at these numbers. Is there a good resource to help me through the credentialing process and the credentialing process? Outsource someone to do it or dive in and do it yourself? Well, in terms of is there a good resource, before I tell you about our course on credentialing, I would tell you to go and look at our blog at npbusiness.org and search for credentialing. We have written on this before. If you are a member of NPBO or our startup course or any of those things, you'll find that information in those resources as well. I actually couldn't find a lot of information on credentialing when I first started doing this myself, and I learned by trial and error. I do believe that we should at least know how to do it ourselves. If we want to turn it over to someone, we can certainly do that. It's costly and not everybody does it right. And in fact, one of the reasons that I created our DIY credentialing course is because I was hearing from nurse practitioners who were telling me that they hired somebody to do their credentialing. It didn't get done. The person didn't contact them again. They didn't know what to do and how to proceed. And so this particular course walks you through what to do. It's an easy process. It's data entry once you have all of that information, but it is tedious. It is time consuming. You do have to follow up, but it certainly can be done. And I'll put a link to our credentialing course below. On average, and on the conservative side, how much do I require to start an NP practice? Can you guess my answer? It depends. I have no idea what kind of a practice this person has in mind. They could be looking at a practice that is maybe just visiting patients in assisted living and long-term care facilities. And if that's the case, the overhead is really pretty darn low versus starting a medical spa or a 6-room urgent care with a primary care on the back side of it. That's a whole different monkey. And so you're going to have to know exactly what it is that you want to do. One of the first things that I recommend that everybody do when they're starting to think about a business before they go out and buy anything or do anything is to actually sit down and do a plan. Figure it out. Do your homework and find out what is it you're looking at and what is it going to cost you in your location, because it's going to be quite different in Columbia, Missouri versus San Francisco. So the cost is going to be a lot different. So just, again, look at what it is that you want to do, how you want to get started, and then go forward from there. Can you recommend any training resources regarding documentation and coding? Thanks. So there's a couple of things that I can recommend. First of all, if you are an AANP member, I recommend going to the CE Center where you can access previous continuing education. And there's usually always a coding course in there. So I would definitely take a look at that. The other thing, and one that I've been recommending for years that was really, it was succinct, it was easy, and it's very affordable, and that is emuniversity.com. So E is in evaluation, M is in management, university.com. It's actually courses taught by a physician who's a certified coder. And so he talks about how to go ahead and do your documentation that helps you support the level of service that you've been doing, but not over documenting and not over coding or under coding. So I think it's very good. And I'll put a link below as well. So can a chiropractor be a collaborating physician? And my answer to this is going to be no, to the best of my knowledge. In most cases, when collaboration was put into place, they were not even thinking about chiropractors. They were thinking more about MDs and DOs. And if you look at the type of education we have and what the intent behind some of this is, without getting into the political downside of all of that, is it needs to be a physician, an MD or a DO. But again, as always, your state may vary, so please do check with your scope of practice in your state. And our final question today is, do you have to have a physician in your business? And the answer to that really is no. In most states, when they talk about collaboration, that does not mean that the physician has to be physically present. There may be some rules on collaboration where somebody does have to come into the office at certain times or does have to come in and co-sign, or you can do it virtually, as so many things are done these days. But to my knowledge, you don't have to have somebody physically working in your practice. And the other part of that too is, and you want to be careful of this, and we'll talk more about this because I've got a lot of questions on collaboration, but in some states you cannot hire a physician. You can, there's rules about the corporate practice of medicine, and a non-physician cannot hire another physician. So you have to find ways to work around that if you're in one of those collaborative states. So the answer to this question is no. So that's it for our questions today. Thank you so much for taking the time to listen. If you'd like to submit a question, you can do so at bit.ly, bit.ly /QOW for question of the week, or send us an email at npbohelp@gmail.com. Please consider visiting our blog. There's over 10 years worth of information there about nurse practitioners and business. And if you're looking for courses or consultation, visit us over at clinicianbusinessinstitute.com. And of course, you can find us on all the social media sites. So thank you so much for taking the time to listen today. And I'll see you next time for another question of the week. Bye-bye now.